The posterior retroperitoneoscopic adrenalectomy, removing the adrenal gland through the back, is rapidly gaining favor just in the past several years in the United States. It was championed by a German surgeon, Dr. Martin Walls, who's probably done over 600 or 700 of these now. Our major contribution to this recently has been the application of the robot, the Da Vinci robot, to removing the adrenal gland through the back. And that's the real innovative part of the study that we're talking about now. Since the early 1990s, we have taken out the adrenal gland with minimally invasive or laparoscopic approaches. And in the beginning of that experience, most surgeons in this country performed a laparoscopic adrenalectomy with the patient positioned on their side on the table with the transperitoneal approach, or several small incisions underneath the costal margin. And this is a good approach to removing the adrenal gland, especially for small, benign adrenal tumors. However, it has some disadvantages, including the need to mobilize other structures in order to access the adrenal gland, which is located posteriorly or in the back of the patient. A newer approach, which we've been very interested in developing here, is a retroperitoneoscopic or posterior adrenalectomy, which is done with the patient prone on the table, and it requires fewer laparoscopic ports and can be done in a shorter period of time with less blood loss and less need for extensive operative dissection. The procedure takes about 2 hours of operating time to perform, and that operative time decreases with experience, of course. We were probably the second center in Texas to perform the posterior approach adrenalectomy here, at least with a dedicated experience to that. What we've done most recently is we have applied robotic technology to taking out the adrenal gland through the back, and we feel that this has potential to be a major advance. The advantages of robotic technology, in which the surgeon sits at a console, there's an assistant that's in the operative field, and there is a robot that is docked with instruments that enter into the operative field, which are controlled by the surgeon. Some of the potential advantages of robotic surgery include better visualization. You have a magnified and three-dimensional image that the surgeon can see. And probably more importantly for this operation, there is better maneuverability and mobility of the instruments, which have greater degrees of freedom than you have with straight laparoscopy. This is important for this operation because it's a very small working space. And so we have developed actually robotic assistance to this retroperitoneal approach, what we call RAPRA, or robotic assisted posterior retroperitoneoscopic adrenalectomy. We've done 6 of them now, and to my knowledge I think we're the first people in the world to apply that approach to the posterior adrenalectomy. Of course, we're still evaluating it in terms of its advantages or potential advantages, efficacy and safety.